breaking the wall of vaccine hesitancy through art. Rodrick Sambakunsi, One for All for One, a vaccine engagement project, Malawi.
I'm so excited to be here, and thanks for the opportunity. So what I want to share with you is about a project called One for All for One. This is a vaccine engagement project that took place in Malawi. So with high burden of disease, but also inadequate health service care, but also poverty, vaccines are going to remain our strongest tool for those infections that are vaccine preventable. And the evidence is clear. We have lots of new vaccines coming in. We also have vaccines that are just being reinforced, that have been there for too long now. So we believe vaccines will remain the tool that is going to support us. However, COVID-19 taught us some lessons, but also the introduction of COVID vaccine brought a lot of misconceptions, and these were amplified by the social media. But also, the factors underground in Malawi also amplified this. Some culture, religion, but also misconceptions. All these contributed to a lot of misconceptions about vaccines. So that's why I'm saying our fear is vaccine hesitancy. So if this happens, then we are doomed. So our solution to this was the introduction of this project called One for All for One, which is a vaccine engagement project, which is Malawi-led. It is a collaboration of creative engagement practitioners from Malawi, South Africa, and United Kingdom. But it was also a collaboration with community groups, different levels of community groups, religious leaders, local leaders, students, young mothers, healthcare workers, but also the experts. So these are the researchers. So together, we developed a comic and also an animation. So this was purely developed through a participatory method where these groups contributed to the development of this. So starting from the messages in the comic book, but also the characters in the comic book, all were suggested by the community members, including the researchers. So the comic is about two siblings, Tadala and Maeso, who are found in these voices about vaccines. They don't know what to believe. They don't know what to trust. But later on, they are there to support community participation in vaccine research. So that's all about this. So some lessons that we've learned through this project, I've said it's a participatory project, is that the information about vaccines is accessible. People that are less literate can access it. People that have other disabilities can access it, because we have also included animation. And the resources are also adaptable, so they can be adapted into other contexts. We have translated this into 3 local languages in Malawi, but we believe we can also translate it to other languages. And we have also included some messages in the traditional dances about vaccines. So I'll just share with you a small clip. So thank you very much for listening.
You know, the greater maybe become the questions. And we know from the COVID pandemic, much of the commotion, as you called it, was for continents like ours as Africa, and countries like Malawi and South Africa, is around when you deal with the commotions, as people learn about the vaccine. Have you found after COVID, for example, any less support for the vaccines, considering the commotion that was made around it, especially lack of access and increased cost for Africa itself?
That's a good question. So I might say yes and no at the same time, because I think that commotion at that point was because of the COVID vaccine, and mainly this was related to biblical teachings. They were talking about the 666, the mark of the beast that is coming, and this was linked to the certificates that people are getting when they get vaccinated. So if you don't have a certificate, you're not going to access a building, for example. However, we still see pockets of resistance in some areas. I think this is also coming because there are a number of new vaccines that are coming in, and this is giving people fear to say, why is it that they're bringing so many vaccines? And some of these are probably booster doses of the similar vaccines that were there before. So that's why I'm saying yes and no, because of those factors. Thank you.
I wanted to ask about numbers, the numbers of comic books you're spreading, and also if you have been able to measure some kind of impact of what you're doing.
Great question. So we printed a lot of comic books. The first batch was in English. But later on, we translated in Chichewa, that's one of the local languages, and another 2 languages in Malawi. We have shared our comic books to a number of people from different countries. So the first one, we shared our comic books to participants who came to South Africa for a global health conference. And there we distributed about 600 copies to participants. But we have also distributed these books in schools in Malawi, health facilities, but also some to community members.
Tens of thousands? Or?
Yes, so approximately, I would say maybe 4,000 to date. But we are looking to do more.
Thank you.
Thank you.
Thank you.